Hey guys, in this video we're going to go over how to complete a new order form in the Shining 3D software. Your new order form is essentially your legacy lab slip. So the paper lab slip that you used to fill out with the material, the shade, the patient's name, all that good information, we are going to pivot over to a digital format, and in that digital format you're going to give the lab all the required information prior to taking the scan of the patient. So the first step of the four-step process of submitting a digital scan is to complete that new order form. If we look at the software of the Shining 3D system, what you're going to want to do when the patient's in the chair is select New Order. And when you select New Order, this is your digital version of your lab slip. There are 5 key pieces or 5 fields of information that you must fill out. The first is the patient's name. We need to know what patient the case is assigned to. We also need to know the doctor that's assigned to that patient. So what doctor is responsible for that patient? The third piece of information is the type of dentistry we're going to perform. Restorative, implant, orthodontics, or other. The fourth piece of information is we need to select the appropriate teeth or tooth number that we're going to be working on. And then the final piece of information is the notes field. Within the notes field, there's a subsection A and a subsection B. Subsection A, we always need you to put in the shade. And subsection B would be we always need you to include the material that you want the restoration made in. So, 5 things. Patient name, doctor assigned to patient, type of dentistry we're conducting, the teeth or the tooth number that we're working on, and then custom notes, which include shade and the material we're working on, as well as any other information that's relevant. If the patient already exists in your software, so Marcel is a patient I created earlier, Marcel Smith, you can just click on Marcel and you can take a new scan. If it's an entirely new patient, maybe it's Marcel's sister, Sarah Smith, you'll get a pop-up that says no related patient records were found. So we will need to create a patient. When you create the patient, you just press the plus icon for new patient, and there's 3 pieces of information that you need to input with every patient. So we'll input Sarah Smith, which is information 1, patient's name. We will input the patient's age and the patient's sex. None of the other information is relevant to us in the laboratory, and you likely are storing these medical records in a different piece of software. This software is not going to be your record-keeping software for your patients for 99% of the people that use it. So we really just need 3 pieces of information: patient name, patient age, and patient sex. We're going to want to know the doctor that's working on this case. So you have to select the doctor from the drop-down. If the doctor you want isn't in the drop-down, and you'll need to set this up when you get your scanner, is you need to add doctors. So you'll add whatever the new doctor's name is and press the plus button to add them to your system. So fortunately for us, our doctors are already loaded. We'll choose Dr. Heather Briggs to work on patient Sarah Smith. Type of dentistry is important. So are you going to do an implant case, orthodontics, or just your typical crown and bridge? For simplicity of this example, let's just go with your typical crown and bridge. The 4th piece of information is we need to know the tooth that we're working on. So in this patient's case, we're going to work on the 3rd molar, and then notes. This is the most critical. It's the one people forget the most because it's not a simple drop down. You need to put in the shade, the restoration material, let's say it's a monolithic zirconia, and then any other notes that you would include. So maybe you want to say adjust opposing is okay. Anything else you want to add that you think is relevant for the lab to know, you'd want to put in there. There's a ton of other fields within this software. Up here you can say full crown, Pontic, veneer, Is it implant based? You can select a material from a drop down over here. None of that's incredibly relevant. The 5 pieces I told you at the start are the most relevant. The patient name, the doctor, the dentistry type, the tooth numbers that we're working on, and then notes, which have to include shade and the material. If we can do all of that, the lab will have enough information to properly make this restoration, and we'll be able to successfully ship it to you, within our lead time. So that is the new order process for the Shining 3D software. That's the lab slip in its digital format. The next step will be how to take a scan.